Hi, Becky. Thanks for asking me to give a presentation regarding motivational interviewing to your parish community nursing class. And so I think there's about 15 of you ladies there, so hello. Sorry I'm not there with you in person to answer any questions you might have. But, I've been in practice for 24 years in family practice, so I've been in and out of doors between patients' rooms. I figured if it was 25 times a day for 24 years, about 124,800 times I've gone in and out of the patient room. So when it comes to motivational interviewing, I've had some experience. And what is motivational interviewing? Well, what it's all about is trying to get people to change by asking questions. And that's not easy to do, especially when you want to have a patient that may not be too motivated in trying to do what you would want them to do. So, well, first of all, I think of motivational interviewing as trying to get a patient from point A to point B, or if I don't have a point B, it might just be getting them turned in a direction and getting them moving that way. And there are stages that patients have when it comes to being ready to change. And that might be something from what's called pre-contemplation, when they have no interest in changing, aren't listening to you, to contemplation, where they're thinking, well, I'll think about that, to preparation or determination that, I think I want to do that. Then find an action where they're ready to go and they're willing to make a change. And then you kind of review it again when they come back. I actually like to look at it in a little bit simpler way, and that is when I'm in the room with a patient, I'm sitting there thinking, okay, do I really want to invite them into this? Do I want to encourage them? Do I need to challenge them? It's one of those three, and there may be a time that really works really well of one of those three, and one of those three might be totally detrimental. And trying to know the difference that's just really hard. And you just have to kind of work with that and get a feel for what's going to work best. If you go from inviting, encouraging, challenging to demanding something, then you know you're in a losing game. And so that's when you sit back, take a deep breath, and think, okay, now I'm trying to get them to do something by telling them. And that doesn't work. And so what I do then at that point is just take a step back, try to listen, and then try to get them motivated to make a change. Let me think of an example of this. Maybe one of the greatest challenges, and I really kind of like it, challenge is I see I have a patient that's going to come in the afternoon for a physical. And in the morning, I get the phone call from the spouse. Let's just say it's a gentleman coming in for a physical, never comes in for a visit. And his wife calls and says, oh, don't tell him this, but would you get him to quit drinking? And I think, okay, that should be pretty easy. Well, patient comes in, he comes in for his physical, and my goal when he comes into that office is for him to tell me when he's getting ready to leave that, I think I might cut back on my drinking a little bit. Now that's my goal. And I'm going to do that goal without ever asking him actually to quit drinking or cut back on his drinking. He may come in and I do the examination. I ask him how much pop he's drinking, caffeine, how's he sleeping, heartburn, things like that. And they'll ask how much are you drinking. And we actually do some screening tools. We have a screening tool that will show how much a person's drinking. And it's pretty common that, let's say this gentleman would be drinking a 12-pack of beer a day. That's not uncommon. I see it quite routinely. And what I might point out is that alcohol is related to reflux, not sleeping well, decreased libido, ED, those types of things. That gentleman that comes in probably does not want to go on a medication. And so I'll say, I could give you about 4 different medicines today for your blood pressure that's up, for not sleeping very well, for your heartburn, for your ED, all those things. Or we can make some dietary changes. And cutting back on caffeine and lowering your alcohol would be the 2 things that might be the healthiest for you right now. Or we go right to the pills. And most of the time, the patient's going to say, I think I want to probably quit drinking coffee and pop and cutting back on the alcohol. And sometimes it doesn't work at all. But at least you get the foot in the door, you get the conversation going. They will direct the discussion, not you. And they will tell you through just kind of the amount of dialogue and connection you have with that patient, how much they're going to be willing to do. And that's what you want to grab hold to. So good luck out there, and just give it your best.